Mood disorders and suicide. This is my summary of Chapter 7 of Abnormal Psychology, the 7th edition, an integrative approach by Barlow and Durand. To begin with, mood disorders are the gross deviations in mood. They encompass things like mood depressive episodes, which last at least 2 weeks, and has cognitive symptoms that include feeling worthless and indecisive. Mania is whereby individuals find extreme pleasure in every activity. Hypomania episodes. This is when individuals have episodes that are less severe than mania, but it lasts for 4 days and it doesn't impair normal function. Unipolar mood disorders. Individuals experiencing depression or mania experience one enduring mood. Mixed features. These are when individuals have the feeling of different mood states at the same time, whereby they can be manic, have depression and anxiety at the same time, for example. Major depressive disorders. This is the absence of mania or hypomanic episodes. Persistent depressive disorder, also known as dysthymia, is when there are fewer symptoms than major depressive disorder, but depression remains unchanged over long periods of time, about like 20 years or more. Double depression. This is when individuals suffer from both major depressive disorder and persistent depressive disorder. So it's both major and persistent. Defining criteria for depressive disorders. Specifiers or symptoms may not accompany specific disorders. As an example of a specifier, psychotic features specifier is when depressed individuals experience psychotic symptoms like hallucinations and delusions. They could also experience mood congruent, whereby they directly relate to depression, or they may be mood incongruent, whereby delusions of grandeur lead to depressive episodes and schizophrenia. Anxious distress specifier. This is the presence and severity of accompanying anxiety, and it makes suicidal thoughts more likely because, well, they are both anxious and distressed about the fact that they are anxious. Mixed feature specifier. This is when individuals' depressive episodes have at least 3 symptoms of mania. Melancholic features specifier. When applying for the criteria of major depressive episodes, it includes severe somatic symptoms like early morning awakenings, weight loss, loss of libido, excessive guilt, and anhedonia. Catatonic features specifier, also known as catalepsy, is the absence of movement whereby muscles are waxy and semi-rigid. Patients' limbs can remain in any position they are placed, so it is akin to like a wax doll or wax model. Atypical features specifier. It is not usually pertaining to behaviors, but it can include, well, this specifier is to do with individuals displaying abnormal or unusual behaviors, which includes consistent oversleeping, overeating, gaining weight, suicide attempts, higher rates of comorbid disorders like alcohol abuse, substance abuse, so on and so forth. Peripartum onset specifier. This is when, before and after pregnancy, pregnant women are depressed, or they develop depression. Seasonal pattern specifier. This is acknowledging the temporal specifier of like changes in season, such as, for example, recurrent major depression and bipolar occur at winter for individuals with seasonal affective disorder or SAD. Anyway, moving along, integrated grief is the acknowledgement of the finality and consequences of death and by the individual. This is, however, considered a normal stage of acknowledging that an individual has died, whereby acceptance is one of the stages. Premenstrual mood dysphoric disorder, PMDD. Women suffer severe and incapacitating emotional reactions during the premenstrual period. So this is during their period, whereby they become shackled by mood incongruency, let's say. Disruptive mood dysregulation disorder is the intense negative affect, irritability, and inability to regulate mood in children, usually less than 12 years of age. So basically, DMDD is just mood dysregulation in children. Now I'll be talking about bipolar disorder. Bipolar is the tendency of manic episodes to alternate with major depressive episodes and thus reaching peaks and troughs. Individuals with bipolar 1 have full mania and depression. So they got a lot of energy, a lot of manic, so they're very happy, and depressed, so they're very sad at the same. Well, not necessarily at the same time, but it alternates throughout the day, let's say. Bipolar 2 is when individuals have major depressive episodes that alternate with hypomanic episodes rather than full manic episodes. As I've mentioned before, hypomania is less severe than mania because it doesn't last as long and it doesn't necessarily impair normal functioning. It just makes you a little bit energetic, a little bit more happier, one of them. Anyway, rapid cycling specifier, another of the specifiers, is when individuals move quickly between their depressive and manic episodes. So they change very quickly, let's say. It doesn't respond well to standard treatments as in individuals with this disorder, with rapid cycling symptoms. And it has higher suicide and severe depression though, because of this rapid jumping from one episode very happy to another episode very sad, or vice versa. Cyclothymic disorder is the chronic version of bipolar, but this is more mild and it's just similar to persistent depression. It just lasts longer. Depressive cognitive triad. This was developed by Beck in 1967 and subsequently revised in 1976 by him as well. This is when there are cognitive errors in thinking that negatively affect how we perceive ourselves, the future, and the world. Arbitrary inference. This is when individuals, depressed individuals, emphasizes negative over positive aspects of a situation. So in a way, they become biased to seeing the world as half empty, as opposed to seeing it as half full. I'm using the cup analogy, that is, the glass analogy. Overgeneralization is using a local example to make a global inference. So they're taking that arbitrary inference and then overgeneralizing to the world at large, that everything is all doom and gloom, apocalypse is happening, end of the world, yada yada. Mood stabilizing drugs. Lithium is used to treat mania, even in individuals without pre-existing bipolar. It is known that lithium helps to stabilize mood. As to exactly how, I'm not really too sure. It probably has some effect on the neurotransmitters in the brain. Electroconvulsive therapy, ECT, is the administration of brief electric shocks into the brain to treat depression. Cognitive behavioral therapy. Clients are taught to examine depressive errors in judgment, substituting it with more realistic thoughts or appraisals. They use the Socratic dialogue to do so, as in the therapists, also known as the dialectical method. Interpersonal psychotherapy, developed by Bleberg et al. 1984, it focused on resolving problems in existing relationships and in learning to develop new interpersonal relationships. It encompasses 3 stages. The negotiation stage, whereby both partners are aware it is a dispute and renegotiation, as in regards to their interpersonal problems per se. Impasse stage is whereby the dispute smolders beneath, resulting in low-level resentment, but no attempts are made to resolve the problem. So in this stage, individuals have their concerns, but they're not bringing up their concerns to the partner. They're just hiding it or suppressing it deep down into their subconscious. Resolution stage. This is when partners take action, like divorce, separation, or recommitment. So yeah, they could either lash out against what they see is a problem, or which results in divorce and separation with said partner, or they could recommit, whereby they tell the partner that they have a problem and that they are willing to change and recommit the relationship to, let's say, address that issue and move on. Anyway, maintenance treatment is used to prevent relapse or reoccurrence in the long term, as it is used to prevent relapsing back into bipolar depression, yada yada. Now I'll be talking about suicide. Suicidal ideation is thinking about suicide. It includes developing plans, which are formulations of specific methods or ways to kill oneself. Suicide attempts, this is when the person survived suicide, that they have attempted it and they lived through it. Durkheim in 1951 defined various types of suicide, whereby, for example, the researcher stated harakiri in Japan is when suicides are formalized through this ancient custom, where individuals impale themselves with a sword. This suicide is used to restore honor, let's say, in the family name or so on and so forth. Altruistic suicide is killing oneself as to not bring dishonor. Yeah, that's what I've mentioned before, for the society, family, ethnic group. And harakiri is an example of altruistic suicide. Egoistic suicide is when individuals lose social support. This provokes them to commit suicide. This usually happens in older adults, since, let's say, if their partner dies, then they don't really have that much to live for. They're already old and possibly very alone as well. Anomic suicides is the marked disruption like loss of high prestige jobs. So, for example, the global financial crisis in 2008, the GFC, suicides, of course, would have skyrocketed because a lot of banks were going under, a lot of businesses going under. It was a financial crisis, so that's to be expected. Fatalistic suicides is the loss of control over one's own destiny. For example, in many cults, like the Heaven's Gate cult, they cause their followers to take their own lives. This Heaven's Gate cult suicide occurred in 1997. Suicide treatment. Talking to someone about it could possibly help the individual who is planning on suicide. Gold et al. In 2005 found that talking to 1,000 students about suicide did not increase the risk of suicidal thoughts. This is because individuals who want to attempt suicide, they themselves are very lonely. They want people to recognize that they have an issue, and then thus this could bring about healing and let them deal with the issue at hand. As in, all they want is an ear that can understand their problems, listen to their thoughts, and respond likewise to how they'll get about living life, let's say. Anyway, in summary, we looked at mood disorders, major depressive episodes, mania, hypermania, unipolar mood disorders, mixed features, major depressive disorders, persistent depressive disorders, double depression, defining. We also defined the criteria for depressive disorders like psychotic feature specifier, anxious distress specifier, mixed feature specifier, melancholic feature specifier, catatonic feature specifier, atypical feature specifier, peripatum onset specifier, seasonal pattern specifier, as well as its seasonal affective disorder (SAD). We also looked at rapid cycling specifier, integrated grief, premenstrual mood disorder, dysphoric disorder, disruptive mood dysregulation disorder in children, bipolar, bipolar 1, bipolar 2, cyclophonic disorder, depressive cognitive triads by Beck, arbitrary inference, overgeneralization, mood stabilizing disorders, electroconvulsive therapy, ECT, cognitive behavioral therapy, in interpersonal psychotherapy, according to Bleberg et al. 1994, negotiation stage, impasse stage, resolution stage, maintenance treatment, suicidal ideation, suicidal attempt, Durkheim, harakiri, altruistic suicide, egoistic suicide, anomic suicide, fatalistic suicide, and suicide treatment. Thanks for watching.